Hello and welcome to Diagnosis. We're going to do something different this time. In the spirit of the spookiness, we're going to be discussing cases so profound they have significantly impacted the lives of the doctors. The reason I'm bringing this episode, which is way different from the character of this show, is because there is a generally held opinion that doctors lack empathy. Doctors do not care about the patients that you have to, attend to every day, especially in Nigeria. I've seen that rhetoric be thrown around on Twitter. But I wanted to bring this to the fore of the public because I wanted us to understand just how significant, how much these events impact the lives of doctors. Some are so affected they completely leave clinical medicine. Some have to be checked into mental homes. Some just, have this new sense of self that makes it even difficult really for them to do anything other than look for a way to find a solution to make sure that no other person, becomes a victim of this. They are so absorbed in their work that they lose their sense of self. I hope you have a wonderful time listening to these stories, and maybe that can even stir up some emotions in you to be empathetic towards the doctors that risk their lives daily to make sure that you have your life. I will be joined in the studio today by the wonderful, wonderful Dr. Martha. I will be reading some stories. So before I get right to it, let's introduce you to the wonderful Dr. Martha. It's lovely to have you again.
Hi, always a pleasure to be here.
Welcome. So before I would even go to reading the stories, you heard me right. Tell us that one thing during your brief stint. Are you out of clinical medicine?
Wow, it's the brief stint for me.
So during your brief stint with clinical medicine.
I'm not out of clinical medicine,
Oh,
but
yeah,
okay.
Okay, just give me one scenario or two. Depends on you. Depends on how affected you've been, right? That has profoundly, affected you that in any way.
Oh, okay. I don't think I have anything scary that has happened, but I don't have any scary stories to give you.
Wow.
I've got nothing. Wow. I think, as you said, I think the detachment came naturally to me. I have been detached since day one. So no matter how much I bond with the patient or I will give you everything. I will care for that patient like they're my relative. I will do my job. I would really be invested in the case. But once there's a negative outcome, honestly, I'll feel sad in that moment, but I will move on real quick. So I'm sorry to say, but one case that did maybe affect me, that happened in medical school, and it wouldn't seem serious to anyone else, but I think in that moment I was like, wow. So I think that was in my final year, and during my internal medicine posting. So we used to have these morning reviews, which were basically morning meetings where the team on call, represented by the most junior residents usually, would come out, stand before a crowd, before a gathering of the ogas, and basically be filleted.
I know that.
So yes, so that was basically every single day, Monday to Friday. Yeah, that was a normal occurrence. So I remember one such incident, and there was this resident who, yes, none of the ogas really seemed to respect, maybe because of the circumstances surrounding his residency, multiple failed exams and such. You know how it can be. So he was giving his presentation, but then he had obvious anxiety issues. So he would stammer a bit. He had this intention tremor thing going on. So I think they were just not fans of his generally. So all of a sudden, he had a seizure. And I think everyone was really shocked. I personally didn't even know he had, it's not like we knew him like that, but I didn't know he had a seizure disorder or anything like that. but he had a seizure right there. Like, he was on the floor. Of course, his colleagues rushed to his side, trying to, use their medical knowledge to help one of their own, which is the expected thing. And then, I still remember the nonchalance displayed by the elders. It really took me for a loop that day. I remember one of the consultants turned back because they usually sat in the front row. The very serious ones that like trouble sat in the front row, but most of them sat in the back row. So one of the consultants turned back to us and said, "Students, I hope you can see that. So what's that condition called? What could be the possible causes? They turned it into a percussion session, into a teachable moment."
You didn't have scary stories.
I did not know.
It was a very scary thing.
He turned it into a teachable moment.
Not
and then
one lick of care.
Empathy, zero. So I don't know. I can't remember if he was the one or another consultant basically told him, obviously he wasn't fully conscious or anything, but basically said to him, when people are done with him, let him come and continue. I know maybe that was a joke or just being sarcastic, but the entire experience honestly put me off clinical medicine, because I did feel like I've seen people in other jobs, in other sectors, and that human empathy is always there. It's so funny because my mom has come to visit me and seen me sick. When I say sick, I could barely stand. And she said, "Why can't you call and tell them you can't come into work?" And I said, "I don't just want wahala. Let's avoid this. I will go to work. If I can't stay, as in I will work, not that I will go to work for them to see that I'm dying." I said, "If I can't stay, I will speak to them and at least they can see that I am
dying."
Yes. So I told her, because when you start to make excuses, as they say, yes, a serious medical issue can be an excuse to them. When you see the same senior colleagues with patients, you will not know they are the same people. They will be so sweet and caring and really empathetic. But when it concerns their actual colleagues, they just believe anything goes. So yes, in that moment, I really questioned, do I want to go into this? I can't imagine myself in residency going through something like this, a medical challenge, and this is the attitude of my orgas. So yes, that is my scary story.
That was scary to me, because I don't think I can imagine having a seizure or an asthmatic attack, and it's like, as we were, because do I mean that little? So let me say my own. So mine was a patient, right? What happened was, this woman of blessed memory now, she was sick. She had 3 wonderful daughters. They were the most beautiful little girls I had ever seen. So cute. And then she was brought in from Benue. And what happened was, she was sick a month prior. She had malaise and a fever. It was as if she was having malaria, the regular symptoms. And then she just passed out. Then she was taken to the hospital, and then they said she needed blood. She was transfused, and the blood was not properly checked because it was in a rural community in Benue State. And then she had HIV, and then she started losing weight. They said it was cancer. They did some examinations, and she started having, her abdomen started increasing, right? And then they're like, this does not seem, this might be a cancer. So now she has both HIV and cancer, right? So they bring her to our facility in Abuja, and you can see that there is obvious, and she has lost weight. All the signs of a malignant problem is going on, and nobody's even discussing the HIV now, because just wait, the problems are too much. We check it, an ovarian CA, which is already cancer. Sorry, CA is cancer for my non-medical listeners, which is already advanced. And then this woman is there, and she now has a kidney problem. So she now has, for some reason, it has just progressed to end stage. Her kidneys are shutting down. She's having multiple organ failure, and we're trying to do our best. The family is bringing the money. The sister is there taking care of her. She's like, no, this is my sister that trained me through school. My sister that has been there for me. I have to take care of her. Doctor tell me she'll be fine. And I'm like, no, don't ask me. I'm not supposed to be asked this question? And I'm there and I don't know what to say. I don't want to lie to her. The truth is, this woman will not make it. So we had given her like 2 days. She came in so we gave her 2 days, right? I mean, if she makes it past the second day, it's a miracle. So we're seeing this, she can't breathe because there's metastasis of this thing to the lungs, right? She can't breathe. Her stomach keeps swelling. We're draining the fluid. Her heart is weak. She's just having multiple organ dysfunction. And she's there praying for her daughters and holding them and telling them she loves them. Mommy will be home. And that was now my patient. I come in the morning and all of them are praying for mommy, taking their turns to pray for mom. Before I even check mommy's blood pressure, so I just was going to the nurse's chat. What was her blood pressure this morning? Because that scene, I didn't understand being there. And I think that was
they want to intrude.
That was not happening after my mother's death. So it was kind of hard for me, and then I'm seeing this happen. The mother is praying, the daughters are praying. With her last breath, she's praying for everyone. And her husband, oh goodness gracious, her husband is there holding her hand. And then the next day I'm on call, after she was brought in, I'm on call, I'm making my way to call, and the sister starts screaming, doctor, doctor, doctor. And I'm like, what is going on? My sister, granted, this day she's already on oxygen, she's already on NG tube. We're trying to decompress, we're trying to also help her. She had aspirated, and I just watched this woman breathe her last. And for me, the detachment came easy. If a patient should die, I just say a prayer and move on. I get their names down, I book a mass for them because I'm Catholic, right? But I froze. And I just realized in that moment, I don't think I want to be here. I don't want to be here. Take me away from here. I don't want to be here. Anyway, that was my experience, and that was one of many. Wow. Let me read you a story. So someone sent me this. I was working at a private hospital one time, and I saw this 70-something-year-old woman. She presented with a few days' history of cough. Examination was unremarkable, so I managed her for upper respiratory tract infection. She came back with the same cough about a week later and some back pain. The woman denied any trauma or injury, but the cough seemed to be getting worse. The back pain was not excruciating, so that's himself and the MD, right, thought it was just maybe a masked pain or something. They gave her some antibiotics for the cough and sent her on her way. She kept coming back with the cough and the back pain. We decided to do x-rays at this point, and the x-ray came back normal. Yet weeks upon weeks upon weeks, she will come back with cough and back pain, mostly after like a week or two breaks in between each presentation. So what do you think was wrong with this woman?
That makes me look crazy.
No. Okay, let's just go.
Is it TB?
So I'm thinking TB too. We did an x-ray yet again. Maybe POTS, because she's having back pain, TB.
Spine.
Yeah.
Possibly.
Anyway, we did an x-ray yet again, and we noticed a fractured lower rib. She was sure there was no trauma, and we decided to refer her to a tertiary center for a pathological fracture. I kept in touch with her, and it turned out she has had a nephroblastoma that had metastasized to her ribs. Wow. She passed away 2 months after the diagnosis. It was a really sad ending that changed my approach to frequent presentations by doctors. I pay more attention. The patient receives every possible care offered. We know that with the financial constraints in Nigeria, it can be a bit difficult, but I try. That has shaped me in a way that I can never shake off. Now I'm in the United Kingdom and I'm practicing in an environment where there's health insurance. But it will never stop me from making sure that all boxes are ticked for any patient with frequent presentations.
That's really scary.
That shook that person.
Yeah, and oh no, it would shake anyone. Though I would say that the temptation to stick with the common things occur commonly. upper respiratory tract symptoms with unremarkable examination findings and all, to just think, oh, okay, nothing else seems to be really wrong right now, and take antibiotics, take expectorants, take expectorants. But yes, a chronic cough, of course, you start to think of something more sinister.
But she didn't present it as chronic. That's the thing. She said it was a cough that had started a week ago. So maybe that was what took his mind off of TB. But me coming with that pot, maybe it's, a long-term sequelae of TB that had maybe the...
Okay, but now you said it was the nephroblastoma that killed her.
Yeah, it was the nephroblastoma. That was metastasized to the ribs. And now... Anyway,
God rest her soul.
God rest her soul. So this is one of the reasons why I feel like doctors are really detached. When you see a case like this, how do you recover from it? Where do you come back from? This has happened. This has changed you. So many of them just go, you know what? If you continue to give so much emotions to this patient, you have none left for yourself. I know there was a case one time. There was this young doctor, so it was during a housemanship, and this woman came in. Oh, I'll never forget that. She came in with postpartum hemorrhage. She had just given birth in another facility, and she was rushed in with postpartum hemorrhage, and this doctor was trying her best, doing everything, and she was doing it, prepare the theater, take this woman in, everything, rush, it's an emergency, everything is ready as they are wheeling her in. What is the blood required? They said we need 4 pints of blood. The husband said this, oh, I'm O positive, take my blood. The doctor that's about to assist for surgery saying, I'm O positive, take my blood.
A clown.
And then and the funny thing is that he's ready, and the woman just dies in front of him.
So if he faints during the surgery,
so it was going to be 2 now. So he's a junior resident with a senior there. So the 2 of them will perform it together. I don't know, but in that moment, he's just trying to think, right?
I beg all those theatrics. I don't rate them. Sorry.
I could, as in me, I was the house officer there. I could see all the chaos, and the woman just passed out. As in, she just died in front of him, and he was holding her like, okay, we're going to theater now. Get the blood ready.
Postpartum hemorrhage, I mean, it's not surprising.
And the funny thing was, this was not his first case with postpartum hemorrhage and all of that. Patients have died. But the way it just happened, he froze for a few seconds. He froze, and I mean, that was something that profoundly changed him. It was. So
I can imagine.
Let's come back to that wow. Anyway, so now that brings me to this very important question. With the advent of mental health advocations and the rest, don't you think it's time that this is incorporated into medical practice? That when you lose a patient, there should be psychological evaluation. Don't you think that's one thing that we should even be able to do differently from the older generation? Because how do people cope after having such an experience? How do you just go in, if you are the type that cries, clean your eyes, and you're like, oh, doctor, there's a patient in bed 4 rooms.
By the time you are even crying, your chief is already looking for you. Where is this foolish doctor?
Exactly. Don't you think
where is that my house officer say?
I think it's time. For me, I think it's time. I think these are things we should start advocating for. There should be mental health services in the hospital. And why do I have a personal experience, right? And I'll bring it in. So I had lost my mom, right? Last in 2021, and I will never forget how the doctor spoke to me. So from the look of her case, I knew she was going to die. I didn't want to accept it, but I knew it. So my plan was just, let me see how things go. I was medically, I knew it, but I wanted to have faith and believe that God could do something. And I was trying and struggling between my faith and my clinical understanding of the case. And the doctor comes in and she says, can I speak to you for a moment? I come and she says, hey, so you're the doctor that's a doctor? I said, yes. She said, hey, she don't even know how to die. And I'm like, yeah. She's like, okay. I just said you because you're a doctor. Shut up, father. This was the tone of her voice.
I will report out.
And then I say, no, I'll tell my father. And then she walks away. This was at 10:13. 5 minutes later, my mother arrests. And in that moment, the doctor had gone somewhere else. There was no other doctor there. This was even a national hospital. And my father is in there, my auntie is there, and I just go, you out, nurse, get me a stethoscope. I became a doctor. I don't even know how I did it till date. And immediately she just started gasping. I just saw the dyspnea, everything. I was like, you out, get me a stethoscope, put it in my ear, started doing chest compressions. I was doing that, stay with me, chest compressions, breaking her ribs. I could hear it cracking. And then at 10:18, she dies. And for like a good 2 minutes, I just kept looking at her.
Before pronouncing her?
I didn't pronounce her. Then a doctor passes by, sees me at 10:22 and says, time of death, 10:22. And I said, no, 10:18. Now I go back to the hospital merely a week after, before her burial. And I see that case I was talking about earlier on, right? And I'm sad. And you know what my consultant tells me? Are you not on call? How do I reconcile these two? What do we do? How do we make it so that it is mandatory? I remember calling my friends, because the way I broke the news to my friend was very casual. It was, hey, how far? So my mom is there though. Talk to you later, though. Like, bye. I mean, so how do we reconcile that? What do we do?
Well, like you said, yes, there is some elements of PTSD in the being at a job where you have to continuously see the end of life. It could get to you. So I wouldn't agree going as far as regular psychiatric evaluations.
I think it should be regular.
Where is the time?
No, there is. They should find the time. It's important. It's important. They should find the time.
No, because you said, okay, after every time you lose a patient. I've been on call. 3 patients died. Yes, I did every single thing.
After that,
I did everything I was supposed to do. But these 3 people died at different times. At what point was I supposed to? So as I was the one on call.
After that.
How were they supposed to know that the 3 people would die?
Morning review. After that, they call you, Dr. Martha. I think you should see this. Like, if it becomes a practice, it's something that can happen, right? And I think this is not something that we can exhaust now, obviously. This is something we will need to even call in our senior colleagues to talk about. And I think it will be worthy of another episode. What do you think? Would you be willing to come talk to us about it? Okay, hear from our senior colleagues, and maybe that one can tell you that there's time. Because I believe there's time, right? I believe there's time.
That's fair. Anyway. That would be lovely.
Thank you so much for joining us, Martha. I love having you on.
It was a pleasure.
All right. Bye, guys. And please, general public, I know that we've talked a lot today about some of us that detachments came naturally to, but the truth is this. In spite of that, we're still human beings that just have learned better to package those memories and shove it at the back of our minds, because, like she said, where do you have the time to? I still maintain this time. I'm just quoting her. Where do you have that time? So it cuts us a little bit of slack, especially when some doctors act very disassociated from cases. It's not because they don't care. It's because you're saying this too much for it to become new.
Sometimes they don't care, because you saying a doctor said to you, oh, sure, your mother will soon die. I don't think there's any excuse for that. So I don't agree with
you. Don't care. Yeah. I mean, like the one that said, as we to students, when he's done, tell him that he should continue from where he stopped at words. That's
it's just, and I because she feels you're a doctor. So, but you're a doctor, but you're still the patient's daughter. So there's no way you are going to be detached in that. So there was no reason for her to speak to you like that.
It so happens that we let a lot of things slide in this country. Anyway, it was wonderful bringing the show to you, and I hope we've all had learned a thing or two from this episode. And until next time, I remain your host, Catherine. Welcome to Diagnosis.